Support for Radio Friends comes from La Brunerie Financial, where they work to ensure a lifetime of financial security for people from all walks of life, from investment services to retirement plans. If you're looking for a trustworthy company that has the experience and knowledge to put your interests first, contact La Brunerie Financial, a community-based investment counseling firm since 1966. Good morning and welcome to Radio Friends on Monday, March the 27th. Always a pleasure to have you with us. Hope everything's going well. We're going to talk about our mouth today and going to the dentist. And I was looking up some of the most common problems that dentists deal with. These are the 5 most common dental problems: gum disease, tooth sensitivity, tooth decay, oral cancer, and dry mouth. Now, I'm going to introduce you to 2 of my friends who are really great dentists, and they cause no pain when they put their hands in your mouth. That's pretty much a guarantee. Dr. Philip Batson and Dr. Elizabeth ABE. Good to have both of you here.
Thanks for having us.
These are the most common problems that you see on a regular basis with folks who come to the dentist.
Yeah, that list really highlights, the majority of what we see with issues, and a lot of those are baseline issues that cause, even some more advanced and bigger issues. But the first thing you mentioned, gum disease, or as we would, or as we call it also in the office, is periodontal disease, and that's just disease of the gums and the bone that support your teeth, and it's a very prevalent condition. Nearly 50% of Americans deal with a form of gum disease.
50%?
Yep, that's about the latest stat on it. Yeah.
So what causes gum disease? Why would you have to start dealing with it?
Bacteria in the mouth.
Causing inflammation.
So not brushing or cleaning your mouth properly.
That would be a leading factor. Allowing inflammation to build up in the gums, and anytime the body has inflammation, it creates a response, and it's usually not healthy when there's low lying or any inflammation.
So if your gums are bleeding, is that a sign of gum disease?
Yes.
It is.
Mm-hmm.
Is it because you have not cleaned the teeth properly is why they're bleeding, or you haven't brushed properly? What causes the bleeding?
A lot of times it's just bacteria that's causing that inflammation, and then that causes a response from your body, and your body's actually bleeding because it's trying to get rid of that bacteria.
Okay, so the bleeding is trying to cleanse the body of the bacteria?
Essentially, it's trying to, resolve the issue. That's how your body responding to it. Okay,
let's talk about tooth sensitivity. What causes that?
Oh, wow. That could be a lot of different things possibly. And just because some of the sensitivity could be, say, you have a cavity decay that's reached the nerve, that can cause a sensitive tooth, a painful tooth. There can also be sensitivity from, if you clench or grind your teeth, then that can result in creating tooth sensitivity. If you have a very highly acidic diet, potentially, that can also cause, hypersensitivity of your teeth. If you have gum recession and gum disease, the periodontal disease, that can also lead to tooth sensitivity. So it could be a really varied approach to what could be the cause. And so that's sometimes when patients come in, you just have to look at maybe all the different risk factors and try to find that root cause.
Now, my teeth have always been sensitive, and I know whenever I come into your office and you clean my teeth, the hygienist, I always say, would you please deaden them first? and she's real nice about that. To put that, whatever that stuff is on there, the
little topical anesthetic down there.
Yeah. So people, if you're concerned about any pain, you ask them to deaden the gums before you have your teeth cleaned, and it's not a shot. They just put it on there, and you can't feel anything then. The other thing was tooth decay. How prevalent nowadays is tooth decay? It's not as bad as it used to be years ago, is it?
Probably not, but it's still fairly common. I think it is like one in 4 people, adults, have decay, or at least one cavity.
At least, you mean from years ago? You're not still finding in
Currently.
adults? You're still finding new cavities?
Yes.
Really?
Yes. Yeah.
I would have thought. Now, you haven't found a cavity in me for many, many years. I thought all my cavities were from a kid, and you don't get them anymore when you're adults. But you can still get cavities when you're adults.
Yes, absolutely.
And why is that? Is that from not taking care of your teeth?
Yeah, it could be from a lot of different things, but it could be a result of lack of good home care, or some people, maybe they haven't been to a dentist in 1 year, 5 years, 10 years even, and without having things cleaned and checked, decay can restart on any tooth at any time.
The most of our municipalities have fluoride in the water.
Correct. Yeah.
And that helps prevent tooth decay also, correct?
Mm-hmm.
Now, the next thing I wanted to touch on, and this is frightening when you think about it, and that's oral cancer. How prevalent is oral cancer in adults?
It's more common in older adults, but over 60. But anybody can have it, and it is the higher risk factors come from tobacco use, alcohol use, and history of HPV, or the human papillomavirus. There's a connection with if you've had an infection of HPV, that can also increase your risk of developing oral cancer.
I know one of the last things you do when you come in for the checkup is check for oral cancer. And whenever you do that, I always get a little tinge, because my mother had oral cancer, and that's what she died from. My mother never smoked, and she didn't drink, and she went to the dentist on a regular basis. It started out as leukoplakia, and then it evolved into, full-blown oral cancer, and that's how she died. She lived with 18 years with it. But that's nothing to fool around with. You need to go to the dentist on a regular basis and do your checkup, and that's the last thing that they check for, is for oral cancer. And if hopefully it's not found, but you want to try to catch it early.
Always, and doing the look around in the areas where it's most likely to start up is key. And if anything looks funny, the goal is to have it checked out, a biopsy, and to hopefully just rule it out as something benign. But we always tell patients we'd much rather be safe than sorry.
Right.
With it.
So, and that's an important part of your regular 6-month checkup. So be sure to do that. You think, just going to the dentist. Well, it could end up saving your life. And I know that firsthand with my mother. If you want more information, the telephone number to call is
573-875-7071.
Okay, and if you're concerned about going to the dentist, there is no pain whatsoever. If you go and you have pain, you call me. Tell me, okay? Columbia Healthy Smiles. They're good people, and they don't cause pain. Bye-bye.